One Health Initiative, is it a factually sound concept or just a fad? What is the One Health Initiative? One Health is a concept that involves collaborative efforts between professionals within the sectors of healthcare for the environment, animals and humans. A major aim of this initiative is to create a pathway of information between these sectors so that data related to disease outbreaks, epidemiology, food and drug safety and lab studies can be easily shared. To date, 73 countries and 1,211 professionals and companies have endorsed this concept. Notable examples include the CDC, WHO and the World Bank. So where did One Health begin? One Health is not a new concept. The earliest reference to One Health model was made by Hippocrates in his text on airs, waters and places, where he talked about a link between human health and a clean and healthy environment. In 1821, Dr. Rudolf Virchow was the next prominent figure to reference a One Health concept. He stated, "Between animal and human medicine, there are no dividing lines, nor should there be. The object is different, but the experience obtained constitutes the basis of all medicine." In 1964, the term One Medicine was used for the first time by Dr. Calvin Schwabe, who emphasized a collaboration between human and veterinary pathologists to better control diseases. And finally, in 2004, health experts from the Wildlife Conservation Society developed the 12 Manhattan Principles, which introduced the concept of One World, One Health. It formed the basis of the One Health initiative that is followed today and was the first recorded effort to implement a One Health model in modern healthcare. So, we know that One Health has been around for generations. So why is there a sudden interest in it? Well, there are a few reasons for this. Firstly, human populations are growing and expanding into new geographic area. As a result, more people are living in close contact with wild and domestic animals. This close contact provides more opportunities for diseases to pass between animals and people. Secondly, the Earth has and is experiencing changes in climate and land use, such as deforestation and intensive farming practices. These disruptions in environmental conditions and habitats provide opportunities for diseases to pass to animals. For example, recent projections have suggested that warming temperatures could alter the range for flying fox bats, which carry the deadly Nipah virus. And finally, international travel and trade have increased. As a result, diseases can spread faster than ever before across the globe. Now let's take a look at a real-life outbreak scenario in which human, animal and environmental health are considered separate entities, and the benefit of applying a One Health approach to this situation. In 2006, there was an outbreak of a particularly virulent strain of E. coli, O157H7, in North America. The source of this outbreak was found to be spinach grown in California. The outbreak left more than 100 people hospitalized. The use of just human medicine-based approach to this outbreak considered only elements such as the morbidity, mortality and clinical treatment of those with the infection. However, when animal health was considered, the strain was traced to wild hogs who roamed the areas near the spinach fields. Adding an environmental health perspective allowed the realisation that drought, heavy rains and an overworked irrigation system in the area had led to mixing of fecal contaminated water with irrigation water. Isolated approaches to these three systems resulted in poor outcomes. But when a One Health approach was employed, more efficient measures could be put in place to contain the outbreak and prevent further ones. Now that we have seen the basics, let's look at a more detailed example of the One Health concept in action. This can be seen in the 2004 outbreak of rabies in South America. Rabies is a common deadly RNA virus that is transmitted to humans via bodily fluids of infected animals. In this 2004 outbreak, there were 79 new cases of rabies seen in Brazil, Peru and Colombia. The origin of these cases? The vampire bat. The reason for this new outbreak was that first, the affected population lived in remote and poor conditions, with limited access to healthcare. Next, changes in the primary economic activity of the region had caused a reduction in livestock, which depleted the food source for vampire bats. And finally, the affected population were uneducated about the transmission of rabies through vampire bats. The Ministry of Health in Brazil responded to the outbreak using a One Health approach by deploying interdisciplinary teams to consider healthcare perspectives, such as distributing treatment and prophylaxis to remote areas, whilst also monitoring the bat populations and designing culturally appropriate education materials for affected communities. So, we've spoken about One Health and its benefits. But what are some of the barriers to One Health? There are still significant barriers to the adoption of the One Health concept, despite the fact that huge efforts have been invested in outbreaks such as Ebola and H1N1. Perhaps the most important barrier is the need for key leadership to embrace the concept of One Health, in order to obtain buy-in from medical, veterinary and environmental partners, and to execute a change programme on a global basis. Success in adopting the One Health concept will require overcoming other obstacles, including difficulty in changing the mindset of healthcare providers from one of disease care to one of preventative medicine, the bias towards clinical care, increasing specialisation and fragmentation of the field, as well as a general lack of awareness and education of physicians, and difficulty getting busy practitioners on board.
Run!
So, we think that if One Health is a fashion, it's going to be in style for a long time to come. But now that you've learned about the benefits and barriers of One Health, it's up to you to decide, is it fact or is it fashion?